In this video, I'm going to talk you through the process of becoming a doctor in Australia as a domestic student, as well as some of the terminology that you might come across when you're reading about the process. I think a lot of people, myself included, enter into medical school without fully appreciating just how long and arduous the journey can be. So I want to dehaze the process and remove the mystery surrounding the different doctor titles that do exist and set you up with some realistic expectations of what the pathway to becoming a doctor is actually like. Before we get into it, in case this is your first time visiting my channel, my name's Kajanan and I'm a final year medical student studying at the University of Newcastle. And on this channel, I share information about how I'm trying to live a balanced and meaningful life. So if that sounds like something that you'd be interested in, maybe consider subscribing. Okay, so throughout this video, I'll be using Pam as a case study to show what a typical pathway through medicine might look like. Pam is an 18-year-old bright-eyed student who's wanting to get into medical school at an undergraduate level. The good news for her is that at the start of 2021, 4,153 students commenced studying medicine at an Australian medical school, of which 3,533 were domestic students. So that means there are around 3,500 places for her to potentially study medicine. However, approximately 1,800 of these places are for postgraduate students, which means for students who've already done a degree, meaning that there's only around 1,700 places available to directly enter through the undergraduate pathway. So already you can see that around half of medical school graduates have already completed another undergraduate degree, which are generally a minimum of 3 years. Now, it's hard to say what percentage of med school applicants actually get in. At some universities, it's as low as 5%, but you've got to keep in mind that often the same applicants are usually applying for multiple universities, and so the real number is probably higher than that. And I would strongly recommend that if you do want to study medicine, that you should apply for every possible university that you're eligible to apply for. The real percentage of applicants who do get into medicine in a given year is for sure higher than 5%. I'd probably guess somewhere between 15 to 35%. And so if we assume that there's a 20% chance that you get in a given year, in other words, there's an 80% chance that you don't get in a given year, if you were to continue to apply for 5 years, there's still a 1 in 3 chance that you might not get in. And I don't want to say this to scare you, but clearly you can see that even if you try to get into medicine, there's no guarantee that you're ever going to get in. But in saying that, I truly believe that everyone has the ability to do whatever they set their mind to. So if you do decide you do want to be a doctor, then don't give up. And then you've got medical school. So the average amount of time before you can become a junior doctor is around 4 to 8 years from the time that you graduate high school on average. But it can obviously take a lot longer than this if you choose to pursue something else prior to entering medical school, if you don't get in straight away, or if you decide to do an undergraduate program after completing time in another degree. So let's say that Pam is one of the lucky ones who gets in straight out of high school into a 6-year medical program like the one at UNSW or at James Cook University. Now, it's worth mentioning that 4 to 8 years when you're 18 doesn't feel like a whole lot of time, but speaking from experience, when you're 25 and you're only now getting a full-time job, you do feel like you've wasted some of the best years of your life studying. And then I guess the thing with medicine specifically is that it doesn't even end here. You've still got a number of years of training before you're fully qualified. So let's now look at the pathway when you are a doctor. Okay. So now Pam is a 25-year-old PGY1 doctor, also known as a junior doctor, an intern, or a postgraduate year 1 doctor. At this stage you have provisional registration, and this means that you need to complete 12 months of supervised practice before becoming eligible for general registration. During this first year, you must do a few mandatory rotations in order to receive your general registration, including an emergency medicine rotation, a medical rotation, and a surgical rotation. In the Hunter, New England district, which is where I'm currently a student, you also do a relief term and another term that might be a medical or a surgical term, or something more niche like psychiatry. After you successfully complete your first year, you move on to PGY2, which is also known as your residency year. By now you have received your general registration and have a bit more freedom and responsibility. This is the earliest point in time at which you can start transitioning into specific training programs, but many training programs require you to complete PGY2 year before applying. So what exactly do I mean by the term training programs? Well, there are obviously lots of different types of doctors, and to become a specific type of doctor requires specific training. For example, an ophthalmologist or an eye specialist wouldn't need to know much about mental health conditions in order to effectively treat eye conditions. Similarly, a respiratory physician wouldn't really need to know that much about the techniques used for knee replacement surgery in order to effectively manage lung conditions. For each different specialty that exists, there is a unique college that is accredited by the Australian Medical Council to oversee the training and professional development of its doctors. Examples of colleges include the Australian and New Zealand College of Anaesthetists and the Faculty of Pain Medicine, the Royal College of Pathologists of Australasia, and the Australasian College of Dermatologists. So each college creates their own training program for doctors to progress through to develop the skills required to become qualified specialists. These different training programs have unique prerequisites, varying durations of training, and different examinations as well. And there is considerable difference in the competitiveness for getting onto a training program. And as you probably are aware, surgery is notably competitive, but many other programs are too. But with surgery specifically, it's not unheard of for aspiring surgeons to spend 5 to 10 years doing unaccredited jobs before later getting onto the program or deciding that they no longer want to pursue surgery because of how much time they've already spent trying to get onto the program. Because of the competition for getting onto certain training programs, applicants must start preparing their CV early by doing extracurricular activities like research, teaching, courses, or quality improvement projects. Now, in terms of the training duration for each different program, this varies considerably as well. And for example, if you wanted to become a general practitioner through the Royal Australian College of General Practitioners, or RACGP, it would take 3 years of training at a minimum after internship. In contrast, if you wanted to become an oral and maxillofacial surgeon, in addition to medical school and internship, you would need to complete a dental degree, which is 3 to 4 years, and get through the Royal Australasian College of Dental Surgeons Oral and Maxillofacial Surgery Training Program, which is a minimum of 4 years. So let's get back to Pam, our not so bright-eyed anymore 26-year-old PGY2 doctor who's kind of decided that she's interested in surgery but is unsure if she's willing to commit the next 5 to 10 years of her life to it. As a result, she chooses to do some Senior Resident Medical Officer, or SRMO, time next year. So what exactly is an SRMO? Also known as a PHO, or Principal House Officer. Well, as the name suggests, an SRMO is a doctor who is a slightly more senior version of an RMO, and that is a PGY3 or higher doctor who is not committed to a specific training program yet. You are able to do multiple SRMO years. Now, there are many different options of what you can do once you get to the level of a PGY3 doctor, and I'll run through some of the common ones here. You can do more RMO rotations to get exposure to rotations that you previously didn't do. You can do a full year as an SRMO in one specific area, for example, emergency medicine, that you might be interested in training in. You can do a full year as an SRMO in a more general area, so something like medicine or surgery just generally, to see if you might be interested in that area, or simply to develop your skills to become a more well-rounded doctor. You can locum, which is where you travel around Australia and fill positions of need and get paid pretty well in the process. And finally, you can apply to a specific training program. Now, coming back to Pam, because she is interested in surgery, she chooses to do a general SRMO year in surgery, where she rotates between general surgery, pediatric surgery, ear, nose and throat surgery, and urology. At the end of her surgical SRMO year, she decides that she is willing to make the sacrifices to apply for surgery training. Unfortunately, she is unsuccessful in getting onto the orthopedic surgery training program after her first attempt. However, she decides to continue down this avenue and accepts a job as an unaccredited orthopedic registrar as a PGY4 doctor. So, what's the difference between an accredited registrar, an unaccredited registrar, and an SRMO or PHO? Well, the duties performed by each are often quite similar. The main differences are to do with whether you're on the training program or not. I would call someone who mentally hasn't committed themselves to a training program to be an SRMO. But in my eyes, once you do commit to a training program, you are known as a registrar. And as I mentioned before, if you are committed but you aren't specifically on the training program yet, then you're known as an unaccredited registrar. But if you are on the training program, you're an accredited registrar. Additionally, some training programs, for example, pediatrics training or physicians training, are also broken down into a basic training part and an advanced training part. And so in the first few years of training, you're known as a basic trainee or a registrar, and in the latter parts of your training, you're known as an advanced trainee. But confusingly, this is still also referred to as a registrar sometimes, but maybe it might be called a senior registrar then. And finally, when you pass all your specific training requirements and exams, you receive a fellowship from the college that you are training under, and you are now known as a fellow or a consultant or a specialist. But the learning doesn't actually stop here. You need to continually do professional development, or CPD, to maintain your registration. Now, just because you have the qualifications of being a fully fledged specialist in whatever field it is that you're practicing in, doesn't mean that you can always find a job in the location that you want to. The need for doctors in the country is much higher than it is in the city, and so if you're committed to staying in metropolitan areas, it may be more difficult to find a job, particularly in some specialties than others. But as a medical practitioner, you will always be required, so there never will be a shortage of work, as long as you're willing to travel or live in regional and remote areas. Again, returning to Pam, after working hard to build up her CV, she's able to get onto the orthopedic surgery training program, starting at PGY5, which is at age 29 for her. It takes her 9 years to complete the training, as she takes 3 years off around the birth of her 2 children. At 37, she is now a fully qualified orthopedic surgeon. She thinks back to her naive 18-year-old self, who would never have expected that it would take her this long to finish training to become a doctor. Now, you might think that this example of Pan is like the worst possible case scenario, but I guarantee you that it's not. Sure, if she had chosen to become a GP straight after internship, she could have been done by the time she was 28 or 29. But for those more competitive specialties, it can be an extremely long slog, and it's not an easy journey either. Those years are filled with night shifts and immense stress and long hours. And is this all worth it? I can't really say. It's up to you to make your mind up on what's right for you. But for me personally, I think I've realized that there are many areas of medicine that I am interested in. And so it comes down to other factors like lifestyle to influence my decision. At this stage, I am leaning towards more lifestyle-oriented specialties like general practice or psychiatry, because I know that I will still derive the personal satisfaction that's associated with any career in medicine, plus I get to enjoy my life as well. We've gone through a lot of stuff today, and I'm sure that I've probably overloaded you with information, so let's quickly summarize the main takeaways from this video. Getting into medical school is competitive. Medical school takes roughly 4 to 8 years to complete. You need to complete a 1-year supervised internship to receive your general medical registration, and this involves rotating between emergency medicine, surgery, and medicine, plus another rotation or 2 as dictated by the hospital that you're working at. After internship, you generally complete residency, where you essentially get to perform the same role as an intern, but with a higher pay associated with it. After residency, there are many different avenues that you could possibly take, including SRMO years, applying for a training program offered by a specific college and working as a registrar in that area, or locuming to wherever you're required to work and you're willing to work, most importantly. Training programs typically last from 3 to 6 years, but can definitely take longer than this. And they vary in terms of the prerequisites required to enter and also the competitiveness. Once you pass all the training requirements and exams, you receive a fellowship to the college you're training under, and you become a fully fledged consultant doctor. And finally, the entire process from internship to consultant can vary greatly, from as short as 4 years to as long as 14 years or even longer. Now, there's actually still a lot of other terms that you might see in addition to everything that we've covered today, but given this video is already quite long, I won't go into it here. Instead, be sure to check out the blog post that I've written on this topic, linked in the description, detailing everything that I can possibly think about the process of becoming a doctor in Australia. In this post, you'll also find links to any of the relevant organisation websites where I obtained this information from. If you have any questions about anything that I've covered today, be sure to drop a comment down below. Now, because there are so many jobs that you can pursue once you graduate with a medical degree, and I've really only covered a lot of the clinical ones, I thought I'd make a separate video outlining some of the typical and atypical jobs that are out there, so be sure to subscribe and click that bell notification to be notified when that video drops. If you're interested in getting into medical school and you're trying to decide whether it's right for you, I'd recommend you watch this video here. And if you want to hear more about what it's like working as a junior doctor, you should check out this video here. Thank you so much for watching, and I'll see you in the next one.